The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again, and you can subscribe the same without paying any money, and you can share it with your friends and homeopathic lovers as well as students. The purpose of this forum is to take homeopathy to every home around the world. And let me come to today's guest. As you all know, we have a guest from Bihar. As you all know, it is from the third generation of Dr. Sahani family, and it is Dr. AMIT Sahani. So has completed MD in homeopathy repertory and have PhD in also in homeopathy. So working as the professor, Department of Repertory, RBTS, Government Homeopathic Medical College, Muzaffarpur, Bihar. And he is the author of Conspectus, is widely followed by a book by PG students, and is presently working as the head of the department in RBTS, Government Homeopathic Medical College Hospital, Muzaffarpur, Bihar. Dr. Amit is associated with many homeopathic associations like Homeopathic Medical Association of India, Liga Medical Homeopathic International, Homeopathic Science Congress Society, and many others. He is a member of the Indian Science Congress Society. He is presently working as the General Secretary of HMAI Bihar State Branch, and Sahani is also active member of social organizations like Rotary International and the YMCA. Dr. Amit is also sought as a resource person for seminars by reputed organizations like Bihar State Health Society, Bihar Voluntary Health Association, etc. He has published many books, and he is doing lot of research, working with a lot of research work papers also. Has presented so many sessions in different organizations, and today, he's also won several awards from different organizations, and today, doctor is talking about homeopathic approach to diseases of children. As you all know, doctor has made so many sessions in this forum in both our Hindi as well as in English session. But today, we'll be talking about a very important subject, particularly related to homeopathy and children. We proudly welcome Dr. Amit Sahani to this session. Welcome, sir.
Thank you, Dr. Dhanesh, and thank you, IFPH, for giving me a chance once again on this prestigious platform. So today, and good evening, everyone. So today my topic is approaches to the diseases of children. So this topic of diseases of children, we have to understand that children, like other adults, they are patients and they need to be understood. So let me first share my presentation. Just
yes.
Is this visible?
Yes. Yes.
Yes, sir. So this approach to the diseases of the children, I will start my presentation with this homage to Dr. B. Sahani, and this is some of his words from his book. Meditation on the subtle nature of the homeopathic medicine reveals that it is beyond the physical and the chemical laws. So understanding the nature of the homeopathic medicines, we understand we need to understand, we need to digest this fact that homeopathy is beyond material, and the laws governing the homeopathic medicines, they are definitely not the laws which govern the physical and the chemical laws. So we begin this topic of the diseases of the children. So when the child comes into this world, it comes with trust and innocence. The birth of a newborn is an extraordinary moment, an event that is filled with joy and anticipation. However, caring for the newborn requires knowledge, patience, and attentiveness to ensure their healthy growth and development. The first few weeks and months of life are critical and for establishing a strong foundation for the baby's well-being. So we need to ensure that the child comes into this world with the right sanskar, and we ensure that the life of the child is healthy. Now, coming to the disease aspect, we have an understanding, we have a perception that generally children's and babies, they respond very well to homeopathic treatment. So the reason for it, what we have understood, what we have interpreted so far, what we have understood so far is that it is usually because they have not been exposed much to the conventional medicine. They are unmedicated. They are unmedicated children, and they generally respond much more easily to the medicines, to the homeopathic medicines, as compared to the adults. Homeopathy can be useful for the children because they also help to improvise the child's natural defense mechanism and the immunity, and they also help to restore the state of the good health for the children. So homeopathy is considered as a first choice, is being considered now by many of the parents as a first choice of the treatment for their children. But we have to understand that why and where we can be more efficacious. So with this line from the words of Dr. H.A. Roberts, he said that theoretically, if we could have the child under homeopathic treatment right from the birth, we could govern the diet, hygiene, and environment as well, and there would be very little adult practice left for us. So he's saying that if we are keeping the children right from the moment of his birth under homeopathic treatment, under homeopathy, and we are managing the diet and the environment and the hygiene, sanitation of that child right from his childhood, from his infanthood, then the chances of him or her becoming sick in the future is very less. So that speaks volume of the scope of the homeopathic treatment for the children, and definitely we realize it. All of us in our practice, we have realized that treatment of the children is a very big area which needs to be explored further for the homeopathic practice. So I'll say the diseases of the children is not only a fascinating subject, it is also one of the challenging subject. And because we are exploring into a new patient, where a patient which he can himself tell a very little about himself, where he can describe very little about himself. So we need to explore, we need to take it as a challenge. Now, considering this homeopathic case taking, rather case taking in the pediatric patients, it is very important. Like any other field of medicine, case taking in pediatric subjects, in the children's subjects, it is very difficult task. I'll say Herculean task, because we are exploring into an unknown area. So pediatric case taking and prescription writing is a very hard part for as physician, not only for homeopath, but also for other physicians. For homeopathic pediatricians, it is very important to have a proper case taking of the pediatric cases, because prescription writing, we require totality, and this is why it is said to be the hardest part when dealing with pediatrics in subjects in case taking. In the pediatric subjects, case taking depends upon observation, and observation is the key, as questions during the case taking depend on the observing the behavior of the kid. The observations, they give more data about the children than the children that they can give themselves. to ascertain the constitution of an infant, history of the mother, and obstetric history works as the guiding anchor. So we have to emphasize much on the observations and also on the obstetric history, the intranatal life of the patient. In few words, we can say that the case taking in a pediatric case is not centric on just the patient like any other adult case. So in adult case taking, we rely solely upon that individual, solely upon that patient for our prescription. But for when we are concerned with the children, when we are concerned with the pediatric subjects, we have to rely much more upon the patient rather than the observations, and also the informations that are coming from the parents, especially the mother. So we have to depend upon multiple factors. We have to depend upon the mother's history. We have to depend upon the obstetric history, the relationship with the mother, the parents, and the child, and most importantly, the observations by the physician. So I'll again say that the pediatric case taking and pediatric prescription is a challenge, is very a difficult thing from the part of observation. In the literatures of Fisher and Forbister, the challenges and how to overcome the challenges, they have been mentioned. I have considered those books as the guideline for this presentation, and I'll be discussing some points upon this aspect. So as I said, the practice among the little folks is a part of the character of the conscientious and the painstaking physician. The children are unable to communicate their distress in words. Although they are in pain, they are not able to express it in words. And when they are not expressed in words, the correct information is not conveyed to us. So it becomes very imperative, it becomes very important for the physician to study their language of pain and disturbance of function, and to interpret the tales of sorrow and their signs of anguish. We have to understand the reason for the disturbance, the reason for the pain, and what type of the pain they are suffering from, so that a correct prescription may be chosen for them. So it is very important. It is very important to understand the signs and the symptoms from the children, and rely on the informations that are coming from the parents, especially from the mother. Now we have different books which emphasize the role of mother, the role of the observations from the mother, where we should give importance to them. Now, when we are talking of the pediatric cases, as parents, everybody wants the best for their children. And homeopathy as a system of medicine, it is gaining a popularity in pediatric practice. It is becoming the parents' choice for their children, not only because they are considered as harmless, but also it is considered safe, and as a system of medicine which will not bring any altering effect and altogether bad effect on the health of the children. So the parents, they want a system, want to treat their children in a way where the best can be brought for their child. And when we talk of the homeopathic medicines, they are highly individualized and are chosen based on person's unique symptoms and the overall health. So homeopathy is effective in treating wide range of conditions, including acute and the chronic illnesses, allergies, and emotional disorders. And that is why perhaps it remains the #1 choice for most of the parents when it comes to their children. Now, what is the difference between the homeopathy and the conventional medicine? So when it comes to the conventional medicine, the focus is on treating the specific symptoms, and what Hahnemann has called in aphorism footnote to aphorism 8 as symptomatic treatment. So he says the approach of the conventional treatment is by focusing on the most painful symptom that the patient may be suffering from, or rather the complaint of the patient. So they are given more importance in comparison to the patient as a whole. Whereas on the other hand, our homeopathy, it takes the patient into account, the whole person, including their physical, emotional, and the mental well-being. And that is why homeopathy is able to serve that individual rather than just nullifying the disease or just ameliorating the symptoms of the disease. So as homeopaths, we understand the difference between ameliorating the symptoms of the disease and ameliorating the patient, giving relief to the patient. So both are different. Both are different aspects, and the homeopathic approach, which prioritizes the patient, which gives more importance to the patient, which emphasizes on the overall well-being of the patient, is definitely a more holistic approach and more beneficial for the children's, the pediatric cases. So when we talk of the children, and the question arises, why homeopathy, when we have so many medicines which are available for the treatment, and at a time when the number of we see the number of the researches in the children practices and medicine as a general we are having, and we have to understand what is the reason that we can choose homeopathy, especially for the children. So there are many ways in which homeopathy can be of service to the treatment. So we have to understand that there is a rising trend for the emergence and the re-emergence of many of the acute diseases. We are living in an era where the number of infectious diseases are rising, the non-communicable diseases are rising, and we are called to be the world's youngest population. Our honorable Prime Minister, many a times he says we are the youngest population, and this is going to be an asset for the coming time. But we have to understand. We don't want the future children to be diseased. We don't want the future children to be sick all the time, which will be a burden, which will be a overall a burden for the economy, a burden for the country. So we want healthy children, and homeopathy can go a long way. In helping this young population, these young folks, and they can be disease free. So homeopathic medicines, they are considered to be useful. They are considered to be safe for a number of conditions which are related to the children and adolescents, and the treatment is without any side effects. The medicines, they are palatable and acceptable, and compliance to the treatment is good. So the children, they like the medicines, they like the sweet taste, and as doctors, we must be having this experience that they ask for more. They ask for more medicines. So the medicines, they are palatable, they are liked by the children, they are accepted by the children. So this is one of the biggest asset of homeopathy, because the medicines, they need not be forced upon the children. They are willing to take it. So this is where we stand apart from the other systems of the medicine. As for our functioning, we can say we are definitely safe when it comes to the approach to the children. So we have to understand the place of homeopathy in pediatrics as in any other branch of medicines. So it can be best achieved by appreciation of the meaning, the meaning of the holistic practice. The holistic approach to the pediatric care is based on the principle that body has inherent ability to heal itself. Homeopathy has gained popularity over the years as more and more parents, they seek natural alternatives to the conventional medicine for their children. So it is, as I said, we have already discussed, it is becoming the growing choice of treatment among the parents for their children. They are more and more parents, they are seeking homeopathy for their children. So before we go to the case, we have to understand that what is the reason that there is a growing rise of the childhood diseases, why we are having more and more pediatric patients. So the rise in the childhood disease, it is multifaceted We have to understand that there are factors, especially in country like ours, we have factors like malnutrition, we have factors like poor sanitation, inadequate healthcare access, and environmental hazards. So they are playing a crucial role. They are playing very important role in the emergence and the re-emergence of many of the communicable and the non-communicable diseases. So we have to emphasize on these factors. We have to understand these factors categorically so that we can be our system of medicine can be helpful for our children. So when it comes to the lifestyle factors, we have to understand that the recent studies there have been a concerning rise in the lifestyle diseases among the children. Diseases like obesity, especially the type 2 diabetes mellitus, cardiovascular disease, there is a rising trend of such nature of diseases among the children. So these conditions are largely driven by factors like poor diet, lack of physical activity, and of course, this increased screen time. They are devoting more of their time to the mobiles and the tablets, which are consuming more of their time in comparison to what time should be devoted to the physical activity and other healthy activities. So the malnutrition and other factors, they have always been there in a country like ours, but this is a new development in our children. We can say that we have to be very cautious to these factors. Then also the environmental factors like air pollution, exposure to indoor air pollution, and climate change, they are negatively impacting the children's health. So we have to have an understanding that we have to evaluate these factors. We have to give more emphasis on these factors, and factors like overcrowding, poor living conditions, they also contribute to the spread of the diseases. Then, as I said, there is a rising trend for the emerging and the re-emerging diseases. Emergence of the new diseases and re-emergence of the previously controlled diseases can pose significant threat to the children's health. And we have also factors like antibiotic resistance, public health challenge. They also can contribute to the emergence and spread of the infectious diseases, and they are contributing a lot to the development of new diseases among the children, and they need to be taken care of. So it is often a very Herculean task to portray the disease of the patient, especially when we are talking of the pediatric population. The portrait of the disease, it needs to be, and the totality, it needs to be portrayed before we frame a medicine. We come to the conclusion of finding a medicine for our children, for our pediatric patients. So I'll be describing the approach to the pediatric case taking and the importance of the observation through two of my cases here, and I have taken two cases here. So first is the case of the discoid eczema, the disc-like eczema, and coming in the pediatric OPD of our college. So the patient, she had complaint of a round itching eruption with cicatrices that tend to open repeatedly on the dorsum of the left hand for 6 months. So she was suffering from this discoid eczema, which was diagnosed later on. She was suffering from it for 6 months. So she had severe itching and often burning with thick yellow discharge. So this 14-year-old female patient, she came to the OPD, and this was the complaint which was reported by her parents, and she was suffering for 6 months from this complaint. So along with this, the associated complaints was itching was aggravated by heat and warmth of bed, and it was ameliorated by scratching and cold washing. There was also pain in the abdomen, especially in the umbilical region and in the left iliac fossa, and the pain was aggravated during menses and ameliorated by lying on the abdomen. Since menarche, during every cycle, she was suffering from this type of pain. So this was the overall complaint of the patient, which the parents said during the case taking. In the past history, there was no abnormality, no previous history was detected from the patient. From the family history, we came to know that the grandmother, she was suffering from joints pain. She had desire for salty and the spicy things. The urine was non-offensive, and sometimes there was burning in the urine. Tongue was white coated. Perspiration, especially on the face and the neck, and it was non-offensive. Thirst was decreased and appetite was less. Evaluating the life space of the patient when we did further case taking and the observations. So she was a student, and she has extreme desire for company. She cannot bear to be alone. She always wanted to be in company, and the patient said कि अकेले ये कभी she cannot remain alone, and she cannot remain alone. So when we asked her if she was afraid of anything, she said she was afraid that the disease will worsen and it will become dangerous to an incurable extent. So I asked her what is the reason? What is the reason? Because it is just a superficial skin disease that you are suffering from. How it will become dangerous? So her parents said she is very much conscious, very much conscious of her disease. So very much sensitive. She has been very much sensitive type of individual. And at the same time, they also said she is very indecisive sort of child. She is not able to make decisions when decisions are needed. She is very sensitive to light, and whether it is sunlight or very bright light or artificial light, it immediately causes a feeling of discomfort. She doesn't like, she doesn't want to be in a very lighted area. Now, the physically, she was 4 feet and 8 inches, and her weight was 38 kgs, and she was dark complexion, tall, lean, and thin. And there was no cyanosis, and other examinations. There were physical examinations they were done. They were all negative. We could not find any physical findings from the patient. Now, the analysis, the miasmatic analysis, when the symptoms of the patient, they were analyzed. So the desire for company and the desire for company and where she was afraid, she didn't want to be alone. So it was found to be a soric character in her circumstances, in her situation, and the fear, the suspicion, the fear, the apprehension about the disease that it will become more sick. It was very much dominant feature in her. So it was a psychotic trait which we observed in her. And then the indecisive nature, it was a syphilitic character. So we can say what we here see that the mental aspect of the patient, it is showing the soric character, the psychotic character, and the syphilitic character at the same time. But when we observe the other physical character and other light sensitiveness to light, which is yet another soric character. The pain in abdomen, which is ameliorated by lying down, it is yet another soric character. The pain in the abdomen during the menses, the menstrual pain in the abdomen, which was present in every cycle, it is again a soric character. Then skin eruptions with cicatrices which tend to open. It is although a syphilitic trait, but in this, when we consider it in perspective of this patient, it was considered to be another soric character. And then the eruptions with thick yellow sticky discharges was a psychotic character, and the eczematic eruptions was again a soric character. So overall we see the dominance of the soric miasm in this patient, which is evident, which is again we can say it is a we can preview from the different symptoms that we have considered from a totality of symptoms from the case taking what we have observed. And all these symptoms, they were repertorized. They were repertorized using the synthesis repertory using the radar software. All the rubrics, they have been taken: desire for company alone aggravate, fear of impending disease, irresolution, sensitive to light, then abdomen pain, lying abdomen on ameliorate, pain menses during, skin cicatrices break open, skin eruptions discharging yellow, skin eruption eczema, and itching, scratching ameliorate. So altogether 10 symptoms have been considered for this case. And phosphorus was the repertorial totality. Phosphorus was the repertorial result, which covered all the symptoms, which was followed by calcaria and arsenic. Now, obviously, they are missing in some of the symptoms, but phosphorus is covering all those 10 symptoms which we have considered for the case. Now, after repertorization, phosphorus, as we have seen, it is getting the highest mark, covering all the 10 symptoms with intensity of 27. And the second position was calcarea carb with 19, covering 8 symptoms and intensity of 19. So after analyzing the totality and considering the patient she wants to mix up with people, where she wants to be in company of people, and a phosphorus was the evident choice, and because it is in conformation with materia medica and the nature of the phosphorus, and which desires, which likes to mix up with other people, which likes a company of other people. So it was considered as the best similimum for this case, and this medicine was given to the patient 4 doses for twice daily, and along with this, placebo was given for 1 week, and the patient was asked to report thereafter. So in the course of the treatment, what we have seen the change in the cicatrices, and over a period of time, these are the different images which have been taken at the different period of the time during the course of our treatment, and we see the gradual improvement in this case. And the medicine that was prescribed singly was phosphorus alone. And there was no change in the medicine, and we kept the patient on placebo and a few intermittent. This was required. So this is the further slide which shows further improvement. And finally, the last photograph, you can see there is just a small mark which shows the remnant existence of the disease. And the disease is can be considered to be altogether cured using this medicine phosphorus. So the course of the treatment. So the first report after this was on the 10th of 10/6/2024. So itching reduced and exudation decreased, but the pain in the abdomen was also ameliorated, but no new symptoms was found. So this medicine was again we repeated. This time it was repeated in 1 m potency, and thereafter we had further follow-ups. So we saw improvement in the nature of the itching, the nature of the discharges, and we kept the medicine. We kept the patient on placebo over the period of time, and gradually what we saw that there was further improvement. Now, once we had to repeat the medicine after 2 months of prescription, and again phosphorus 1 m was prescribed, and thereafter the patient completely got cured over the period of time, and we kept the patient on placebo for 2 more months after that, and we got what we saw in the last photograph of the hand, that eczema was completely ameliorated, completely cured, we can say. So that was the first case. Now coming to the second case. This is again a case of a 6-year-old male child from our OPD. So again a case of skin disease. So dry, itching, scaly, hypopigmented patches all over the body, especially the scalp region. Often alternates with some hyperpigmented macules since 2 years. So the patient complains of severe itching, which is more at night and from the heat of the sun and warmth of bed, and it is better after bathing and washing the affected parts. So the patient felt better from washing and from bathing. And the child was suffering from this complaint for overall 2 years, And the parent said he is very much the itching is very much predominant disturbance which is being for this child, and he's suffering so much from the itching complaints. So the other complaints associated with this was reddish discoloration of the patches with some red papular eruptions after scratching of the affected parts. So the complaint aggravated more while being exposed to heat of the sun and increased perspiration. So the itching, it aggravated more from the warmth and the heat of the sun, even from the warmth of the bed, which we have seen in the previous slide, and increased perspiration. So the child was having a good appetite, but the constitution was emaciated, and he was a lean thin child, and the health does not, and he was not growing health wise. So he was not growing health wise, and although he was having a good appetite, he was not he was emaciated. So again, in the past history of the patient, no abnormality was detected. Considering the family history, again, the maternal grandmother of the child, she was suffering from eczema. Evaluating the physical generals from the case taking, the child has desire for salty things. The stool was constipated and irregular. Urine was normal and non-offensive. Perspiration increased mostly on the scalp and uncovered parts of the body. And thirst decreased. Appetite was less, and tongue was white coated and sleep disturbed. Evaluating the life space, it was a school-going child. The child gets easily frightened and has consolation aggravated while weeping. So he had a weeping tendency, and while consoling the child, the consolation didn't give him any relief. In fact, the weeping or the crying of the child, it altogether increased. And he was also sensitive to noise, got irritated from any outside noise. And at the same time, the parent said that he was a very obstinate child. Physical examination, height-wise 2 feet and 7 inch, weight 18 kgs, and average and fair complexion. And again, the physical findings, they were all absent. And here I have written only cyanosis, but all the other, nothing significant was noted in the physical examination of the patient. And so no clubbing and no cyanosis, and everything other parameters, their other findings, observations, they were normal. Now, the symptoms that we have considered for this patient and the miasmatic, considering the miasmatic analysis, the mental symptoms of the child that he was very sensitive to noise is again soric trait. Now, this is a soric feature, and he does not want consolation while crying. Now, this is a syphilitic trait, and then reddish discoloration of the eruptions after scratching. This is soric character. And we have diagnosed that this patient to be suffering from pityriasis versicolor. So again, this is a soric feature, and scaly eruptions, it is soric feature also and a psychotic feature also. So overall, we see the dominance of the soric trait in this child, and the sora miasm is considered is here more important in this child. And then we have a few other complaints. The complaint was ameliorated after bathing. It is a syphilitic trait. The child was emaciated. Desire for salty things are there. There's a psychotic character, and the complaints were aggravated from sunlight and from exposure to the sun. Is again a soric character. So a dominance of the sora, the soric miasm, which we can see. Now the reportorial analysis of the patient. The reportorial analysis, we have taken 9 rubrics for this patient. And we see it is mind sensitive to noise, mind weeping, consolation aggravate, discoloration of the skin, red scratching after eruption, pityriasis versicolor, there is 1 rubric. Then we have skin eruption scaly, bathing ameliorate, emaciation in children, salt desire, and aggravation from sunlight. Light aggravates sunlight. So these are the 9 rubrics that we have taken. And the Netramure is covering the highest number of the symptoms. Incidentally, incidentally, the diagnosis of the patient, pityriasis versicolor, is being not covered by netramure, but netramure is covering the patient as a whole. So this is what I always explain to our students also, that it is the patient which is more important in rather than the diagnosis. And of course, we see that pityriasis versicolor as a rubric is present in the repertory, but incidentally, the totality of the symptoms is calling for netramure, and netramure is not present in that rubric pityriasis versicolor. But we prescribed this medicine, netramure, because it was covering the highest maximum number of symptoms for the patient. It was covering the patient's symptom rather, and it was covering the 8 symptoms among the 9 symptoms, and the intensity was 18. And CPI this was followed by CPI. It was covering 7 symptoms out of the 9 symptoms with an intensity of 15. So after analyzing the case, after seeing the totality of the symptoms and looking at the Materia Medica, confirming it with Materia Medica, netramure was selected as the best similimum for the concerned case. We prescribed netramure to the patient. Netramure 200, 6 dose for twice daily was prescribed. And we gave this placebo for 1 week. So after prescription of the medicine, we saw the eruptions which was present. The eruptions which was present, it gradually went off. It gradually went off, and this patient was also treated, cured. Now coming to the follow-up and the changes and the medicines that have been prescribed after that. So in the first prescription, the itching complaint, it improved. The scaly eruptions also improved, and we just prescribed placebo. Then thereafter, there was the improvement continued, but we prescribed netramure 1 mg for once, and then we went on with placebo for our further course of the treatment, and we continued the treatment for 2 more months. And gradually there was increased improvement in the itching improved completely, and the scaly eruptions, they also went off gradually. And finally, after just 1 dose of this netramure 1 mg, the patient completely improved, and we had this, the result that we saw. Now, before we move on to the closing end of our presentation. I have to say that the one thing which comes off from every book or from every experience which has taught about the pediatric case taking and the senior doctors, they all emphasize on the observations of the case. And when we look at even at the book of Essentials of Pediatrics, by Dr. Praveen, he says that it is an allied book, and it is very famous among any doctors who is practicing pediatrics. So he says in his case taking for the pediatric folks, he says that the art of pediatric case taking lies on 3 points. It is observation. Then this has to be followed by interpretation, and lastly confirmation by the parents. This is very important. And what we observe, what we think, we cannot conclude just on the basis of our observations. And we have to confirm it from the patient party. And since we say pediatric cases, the confirmation can only be done by the parents, and especially the mother. And he further says in his book, the crux of the pediatric case taking depends upon observation. One has to observe. One has to understand what to observe in a child. After careful observation, proper interpretation of these observations has to be made. Once this is done, direct questioning to the mother is needed to confirm your observation, and this completes the first aspect of the case taking. So pediatric case taking is incomplete without the assistance from the parents, especially the mother. And then the emphasis upon the mother, the emphasis on the mother's observation has been asserted by Dr. Desai, again in his book, Bring Up Healthy Children with Homeopathy. This is one book which is very important from the homeopathic pediatric point of view. And Dr. Desai, he says in this book that the mother is usually the most reliable person to provide necessary details, as she watches the child more closely for most of the time. So uh, we have to understand the importance of observation. We have to understand the importance of making proper interpretations, not only observations, making proper interpretations with the assistance of the parents, especially the mother, because only a correct interpretation will take us to a correct medicine. Because again, we have to understand that homeopathy as a system of medicine, we need to be guided by our symptoms rather than the name of the disease. So the understanding of the disease, the presentation of the disease, the general symptoms of the patient, they have to be given more emphasis before we can conclude a medicine for any child. And that is why the reliability on the observations and the confirmations from the parent is necessary. So I'll say the future prospect for the future prospect for the pediatric and the approach to the diseases of the children is that we are having a positive impact upon the pediatric population. As we always have seen, the parents, they keep homeopathy as a first choice for the treatment of the children, considering the harmless effect of the homeopathy, considering the less side effects from our system of the treatment. So it is going as a popular choice. Then one of the future aspect that needs to be further explored is integration of the homeopathy as a system of medicine in the childhood public health programs for the childhood nutrition and the disease prevention. So this is one area of community medicine where we can integrate this our homeopathy into the public health programs for elimination of so many common childhood problems like anemia and like allergic diseases, like diseases like tuberculosis. So we can number of diseases we can incorporate homeopathy, and we can get better results, and we can also help the national economy. The disease that the burden on the national economy can be lessened using by involving homeopathy as a system of medicine in the national health programs. Then one of the another area of the future prospects for the pediatric homeopathy is that increasing research and the clinical studies need to be done for validating the effectiveness in the pediatric care. Homeopathy as a system of medicine, we are lacking much in the research arena. And if more and more research works can be done, more and more research works can be validated, then we can say that the approach to the diseases of the children, they can be more simplified. They can be more simplified using the homeopathic system of medicine. But unlike again say it is a very Herculean task, especially to make the portrait of the disease, because we don't have first-hand information from the patient. We have informations which needs to be filtered, which needs to be re-examined, and therefore we can say the approach to the diseases of children is quite different. The physician, we as physicians, we should be flexible, we should be tactful, we should be intelligent in dealing with them, and must spend enough time to gain the confidence as well as to get the real picture. So we have to get involved with the children if you want to see the real picture, if you want to see, if you want to frame the right totality. And because an obstinate child, an unfriendly child will not tell you much, and you'll have very little informations to prescribe upon. So observation. So for making observations, we need to enter the life of the children, and we have to use our knowledge of tact. We have to understanding of the psyche of the children, so that we can gain more informations from the patient's end, which will be meaningful, which will be helpful in finding the right medicine for our children. So
yes, doctor, we can have a second part if you have a lot of things to share in this.
We'll just wind up, Dr. Dhanesh. We'll just wind up. So the accurate observations, they many times help the clinicians for the correct diagnosis, and also to find out the homeopathic simillimum. The child's behavior and disposition, they are also to be considered. History of the antenatal and the postnatal informations always help in the diagnosis as well as selecting the correct medicine. So as homeopaths, we believe in individualization. And while treating all types of the cases of the children, including the patients of the pediatric age groups, we have to have meticulous emphasis on the observations and the correct history taking of the pediatric cases, chiefly to help to determine the choice of the remedy. So with this, we can say we can explore new areas. We can share new cases among ourselves for to emphasize how much observant we can be for finding out the best medicine for finding out the simillimum for the case. So with its holistic approach, we can say that homeopathy plays a crucial role in the pediatric healthcare. It provides safe, effective, long-term solution, ensuring the overall well-being of the children. As demand of the natural and gentle treatment is on rise, homeopathic role in the pediatric diseases, they will continue to expand significantly. So with this, I can say thank you. And questions, if they are there, I'll be happy to answer them. Thank you. Thank you, Dr. Dhanesh, and thank you, IFPH, once again for giving me this chance.
Thank you, Dr. Amit Sahani, for such a beautiful session in this evening. And as you rightly point out, treating children is something great, and they are the future generation. So if we get the child from the very childhood, from the very younger age, definitely we can improve the qualities of the person in a good way. We can mold him to a good person in the future also, not only by simply treating a disease or simply and removing a disease condition, but we can make him a healthy person by all means. That's what we got from this session. And it's the time for discussion, only a few minutes remaining. That's why I'm cut shorting my thing. Those who want to participate in discussion, you may please raise your hand. I think Dr. Manoj can begin the session.
Some technical problems, I think.
Okay, now it is okay.
This computerized program or the
Maybe the network may be weak. That's why.
You are not audible, Doctor.
Yeah, still there is problem. Okay. Now I invite Dr. Sridhar Kumsar to say a few.
Sir, it was a very wonderful session, very good, excellent. But I like to ask one question. Okay, I can ask. Yes, Hanuman mentioned that 284 paragraph where the mother, if the child is infants, if they are suffering, give the medicine to the mother. What about your opinion about that?
Yes, sir. I'm very much of the opinion that the writing, and I'm very much in accordance with the writing of Dr. Hanuman. And we have practically seen that, especially in cases of infants, if we are giving the medicine to the mother, we see the effect upon the children also, especially if they are if the infants who are being breastfed, we see the impact of the medicine on that infant level. So I'm very much of the opinion that the mother they can infant cases. And also for the after post delivery we have seen in many of the hospitals the mother is prescribed given arnica montana post delivery, and that arnica montana not only helps in the healing of the mother also, but for that child also who has gone through this trauma of labor and come into a new world. So we have seen that this arnica helps that newborn child also in that circumstances.
Thank you, Doctor. Very good. Very good.
Okay, sir. Now it's up to Dr. Rambarisha, sir.
Thank you, Dr. Dhanesh ji, and everyone. Namaskar and congratulations Dr. AMIT SAHANI. Very good presentation. Excellent session. Describe the pediatric disease according to homeopathic science and homeopathic medicine. Very useful medicine in children case. Uh, very good describe the case presentation. Pityriasis and eczema. Select remedy according to miasmatic. Analysis of miasmatic and select phosphorus first case and second case latramute is very good described. Thank you, Dr. Amit. Thank you.
Thank you, sir. Thank you, sir.
Homeopathy was popular because of the pediatric cases in the beginning, but then only it gradually grows into the all sort of cases that comes on. If a person is able to cure a acute case in a child, definitely he will get more and more cases in. Am I right?
Yes, sir. Yes, sir. Definitely, sir.
Now, what kind of confidence the new generation doctors have in your city?
Sir, I didn't get your question, sir.
What kind of confidence the new generation doctors have? Follow me or not? Whether they are confident enough to practice homeopathy in your places.
Yes, sir, definitely, definitely, sir. We have, especially in our state of Bihar, we have a lot of good number of practitioners, and we are there are so many colleges, so they are coming up with so many doctors, and at least we can say for our state, we have a trend of practice of homeopathy in our state. And in our state, we have a lot of homeopathic doctors, and all of them they are having cases, and even the new doctors they are coming up, and they are opening their clinics, and they are finding good cases. I see among the especially in our OPD, the cases that our PGTs are seeing, and the confidence they are gaining from those cases. I can say with confidence that they will be good practitioners in future.
And now I invite Dr. Manoj to say a word of thanks to the person.
Thank you, sir. Thank you.
Thank you, Dr. Ramesh and Dr. Amit Sahani, sir. Nice presentation, but I think a bit fluency is needed in the presentation, then it will go more beautiful. So try to modify your presentation also that way. On behalf of IFPH, I express sincere thanks to Dr. Sahani, Amit Sahani, Dr. Ganesh, and all those participants in this English. So thank you.
Thank you, Dr.
Thank you.
Thank you, Dr. Amit Sahani, and those who do the session. And tomorrow we will have a session from Dr. Rajeshwari Rapte, and Dr. will be talking about physician heal thyself. Hope all of you will join us tomorrow at the same time. You can use the same link that we shared for you for the session. Thank you all. Good night. Thanks. So what to Dr. Mariamma John tomorrow in the Malayalam session.
നന്ദി സനേഷ് ഡോക്ടർ എല്ലാവർക്കും നമസ്കാരം.